Hello, welcome to ANA community. From the past several videos, we are discussing about the concept of Sapeksha Nidana and Vyavachedaka Nidana. Initially, we have discussed the concept of the Sapeksha Nidana and Vyavachedaka Nidana, its application based on the Ayurveda fundamentals. Now, we have started with the description of different models. Initially, we have started with the hypothetico-deductive model with the example. Later, we have started with the concept of the pattern recognition or pattern identification model, followed by the example. Now, we are going to discuss about the dual process clinical reasoning model. When you think about the dual process reasoning model, so that is basically taken up by the book Thinking Fast and Slow, written by Daniel Kahneman, a psychologist. So here, the dual process actually is related to two different types of thinking patterns. System 1 thinking and system 2 thinking. System 1 thinking, that is considered to be fast thinking, or otherwise instinctive or emotional thinking. Whenever any thought, if it is associated with an emotion, that is considered to be responsible for the faster decision making. That is system 1 thinking. Whereas system 2 thinking, that is being termed as slow thinking, or otherwise deliberative thinking, or otherwise logical thinking. So wherein we are going to apply the different logical points to support your thinking processes. That is what you say that system 2 thinking. So here there are few different examples in the different areas where we are going to use it for fast thinking as well as slow thinking. For example, the first one, that's 2:2, 2 into 2. That is, anybody can say 4. This is based on the fast thinking pattern. Whereas the 437 into 13, that is mainly related with the slow thinking pattern process. So that means whenever the larger number multiplication comes, then we are going to use the primitive model of the multiplication aspect if you're not using the calculator. In the other examples, suppose if you are interacting with a close friend, that is mainly related to fast thinking itself. You are not worrying about what the other person thinks, what the other person feels, what the other person does, etc. So that is the interaction. That means as they are coming in his mind, etc., that will be actually spoken in case of the person with a close relationship. Whereas the interaction with the total stranger, that is mainly related to slow thinking. What the other person thinks, what the other person feels, what the other person acts, what maybe his responses, etc. You are not knowing. So at that particular time, you will be giving your responses slowly. Whereas going to the total known place, such as going to the grandparents' home or the going to the your own home, etc. So you are mainly switching the that fast thinking as such. What are the different shops available on the left side? What are the shops available on the right side, etc.? What are the different places that you want to visit in your grandparents' home? What are the different play you are going to do when you are reaching your grandparents' home, etc.? So that is mainly related to fast thinking pattern. Whereas going to a total unknown place, what is the condition of the road? What is there any deep curve is there or not? What is the condition of the environment of the other unknown place itself? And what may be the what do you say that the living behaviors of the people in the unknown place, etc. That is mainly you are going to apply your slow thinking pattern. patient interacting with the Ayurveda specialist. So that means he is having the interaction with the fast thinking individual as far as Ayurveda fundamentals are concerned. Whereas interacting with the layman or the family members, that means the patient will be talking Ayurveda, that is mainly related to the slow thinking. They are not having any idea of what they want to, what do you say, that they speak, etc. That is, they are going to give the opinions from their perceptions as such. In other words, little attention or mental effort is needed for system one thinking, that means for fast thinking, whereas more attention and more mental effort is needed for system two thinking. That means whenever if you are seeing your close friend from far away distance, you are not seeing his the face itself, you are going to see only his back. You can able to identify from far away distance itself. This is mainly related to the slow thinking, fast thinking pattern. Whereas looking the total stranger, that is mainly related to system two thinking or otherwise slow thinking. When you think about the application level, suppose the person is presented to you on phone saying that he is suffering from cough. So what is the immediate image that comes to your mind? That is, he may be suffering from pranavaha srota affliction. You are going to say that visit the hospital or your clinic, then you are going to have an interaction with the person. Then you are going to come to know that he may be having the pranavaha srota affliction, or he may be having the annavaha srota affliction, or he may be having rasavaha srota affliction. So that means you are going to in the what do you say that the interact, and you are going to link the nidanas mentioned for pranavisrota affliction, that is shayat sandharana draukshat vyayama shuditasya cha pranavahini dushyanti srotam sanyasya darunaihi. Regarding annavasrotas atimatrasya cha karajahitasya cha bhojanat annavahini dushyanti vaigunyat pavakasya cha Gorushitamatis snigdam atimatram samashnata rasavahini dushyanti chati chintanat. When you think about these are the nidana that you are going to analyze in the patient. As far as lakshanas are concerned, it is atisrishtam atibaddham prakupitam atisrishtam atibaddham kupitam alpalpam abhikshnam va sashabdashulam uchvasantam drishtva. We are going to analyze pranavasrota subflexion. Then anannabilashanam arochaka vipako chartim cha drishtva annavasrota subflexion. अश्रद्धाचार्यश्च स्वैरस्यमरसज्ञता उल्लासो गौरवं तन्द्रा साङ्गमर्दो ज्वरस्तमः पाण्डित्यं श्रुतमानोदः क्लैब्यं साधः कृशाङ्गतः नाशोग्ने रयथा कालं वलयः फलितानि च. So we are going to link the nidana, lakshana, etc. And we are going to ask regarding the same in terms of the history regarding onset, duration, severity, course of the symptom, aggravating and relieving factors, negative history, etc. Based on that, we are going to come to a conclusion the person may be suffering from the 2 or 3 systemic or srotas affliction. Based on that, you are going to do the Rogi Pariksha in terms of the, what do you say, that the Shadvida Pariksha or Chitrivida Pariksha or Chaturvida Pariksha or Ashtasthana Pariksha or Dashavida Pariksha. And then you are going to come to a conclusion or narrowing the diagnosis. That is what we can say the system 2 thinking. Whereas system 1 thinking, by looking into the one particular lakshana itself, we are going to say that he may be suffering from this particular systemic illness. This particular source of affliction is there. Only after having an interaction with the patient, only after doing the certain physical examination of the patient, only after suggesting the laboratory investigations and looking into the reports of the laboratory investigations, you are going to make a conclusion the person may be having this particular srotas affliction that is considered to be system 2 thinking. As far as the take-home messages from today's discussion are, dual process diagnostic clinical reasoning model involves 2 types of the thinking processes. System 1 thinking or otherwise fast thinking or emotional thinking, and system 2 thinking, or otherwise also known as the deliberative thinking or logical thinking. Whereas fast thinking is possible when the person is frequently having the working on a one particular system itself, such as Kaya Chikitsa specialist or Shalya Tantra specialist or Prasuti Tantra specialist as such. Whereas slow thinking is possible when the person is seeing the case for the first time, etc. For example, the PG student of the Prasuti Tantra or Sri Roga. So like that will be mainly related to the slow thinking as such. Whereas associated memory is related with the systems thinking, such as sneezing may be responsible for the pranama sroto dushti, whereas the association of the multiple concepts together, that is mainly related to the, or do you say that system 2 thinking, or otherwise logical thinking, based on the Prashna Pariksha, based on the Pratyaksha and the Anumana Pariksha, etc. Dear ANA community, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you would like to hear in the coming days? Mention in the comment box below, and spread this particular video to maximum number of true Ayurveda learners so that we can make a huge movement out of this particular small video. That's all for today. In the next video, we are going to learn this particular model with one example. Thank you.